Hello, my friends. Welcome to our May Cyber Meetup. I am Luis Alvarez, President and CEO of Alvarez Technology Group, and with me today is Neil Malwani, the service manager here at ATG, but also one of our cybersecurity experts. We welcome you to the meetup and hope that you will enjoy your time here. We spent 30 minutes giving you information on all what we think are topical things that are important for the public at large to know about, and also have some fun with it. So hope you enjoy it. If you want to ask questions, there's a Q&A button that you can press, and we will try to answer any questions while we're live. If not, we'll get back to you afterwards. And of course, once we're done, this recording of this meeting will be posted on our YouTube page, available through our website, so you can share it with your friends if you think it's a valuable information worth sharing. So with that, we'll get started. Today, we're going to talk about the new HIPAA rules that go into effect either later this year or next year. And we'll talk a little bit about that process and where we're at in that process. And we'll also talk about third-party vendor management and how that ties into these new HIPAA rules, and just in general why it's a good practice. But before we get started with that, Anil, you want to highlight a recent cybersecurity incident that occurred just this week that impacted the Sheriff's Department here in Monterey County?
Yeah, for sure. Thanks, Louis. Yeah, you guys may have heard on the news, I think it was both on KION and KSBW recently, that on Tuesday, some phishing emails went out that were impersonating Sheriff Tina Nieto from the Monterey County Sheriff's Office. Looked like a secure encrypted email that you'd received, and you could click on it, and it would harvest your credentials. It basically wants you to put in a password to get through it, and people would tend to use the same password that they use for their email, and then it would harvest your credentials. It's actually caused a fair bit of stir in the cybersecurity community, to the point that the NICRIC, that's the Northern California Regional Intelligence Center, which is our government entity that is responsible for cybersecurity with government entities and municipalities, actually touch base with us, because we're partners with these organizations, just like InfraGard with the FBI and things like that. And they're like, hey, have you guys heard about this? And like, yep. And we're actively working on a couple of incidents that have come out of this, where we're trying to help and maintain our client cybersecurity through it. And she was able to share some more information with me too. It was pretty interesting that it was created with a phishing tool that they don't normally see being used out there in the wild, that actually specifically looks for private email addresses. So like if you click the link and you entered in like an email address ending in .gov or even outlook.com, it wouldn't even ask for your password. It would it's not even interested. But if you entered in a private, like a IBM.com or something along those lines, that's when the harvester would kick in and say, yeah, give me your password, and move on from there. So pretty interesting, and it just shows how important it is to maintain those partnerships with these kinds of security agencies out there in the area.
Yeah, and unfortunately in this case, a lot of people fell for the email. It looked like it came from a legitimate source, right? The sheriff is sending you an email, and she wants you to do something, so you do it. And then some of the people that got compromised, their email accounts sent out a bunch of emails to their vendors and their contacts in their email, and so those folks got fooled into doing the same thing. And so you've had this cascading effect that I think will continue to impact the local community for a while. But if you've gotten any of those, an email from a source that you don't recognize, or from an official source like a city government or county government, and it looks a little strange, be careful what you click on over the next few days, because I'm sure this will be cascading for a while, and you want to protect yourself.
Absolutely.
All right, well, with that, let's get into our topic du jour. So I'm going to start out by talking a little bit about the new HIPAA rules and why it's important to all of us. So HIPAA has been around. The Health Insurance Portability Act has been around since 2003, and the idea behind it was to help protect personal healthcare information, PHI, basically patient's information, things like your medical records, but also, things like your phone number, your social security number, all the usual things that we sometimes refer to PII as personal identifiable information. And so in 2003, they passed some rules to implement those protections. And back then, technology was not a major factor in healthcare. So the rules were largely about protecting paper documents and how you stored things and, filing cabinets, those sorts of things. Then in 2013, as the technology started to become more prevalent in, medical facilities and in medical institutions, they decided to expand the rules, and they started including rules about protecting information that is, stored digitally. But the problem with that was that a lot of these rules gave a lot of wiggle room in the implementation of the cybersecurity portions of HIPAA. So HIPAA is a whole set of rules, lots of stuff, but the security piece of it gave covered entities a lot of wiggle room to avoid having to implement a lot of the more onerous things in the rules. So a lot of medical offices would just say, hey, we don't need to address that because there's a provision of the HIPAA things that says that if we talk about it and address it, but decline to implement this particular compliance rule, then we're covered. We're following HIPAA. And this also, not only affected covered entities, but also something called business associates. For those folks that operate in the healthcare industry, you know that if you are a supplier or a vendor to a healthcare provider, then you are considered a business associate, and you have to sign a BA agreement that essentially binds you to protect the PHI, the patient health information, as if you were the covered entity or the medical institution itself. So it really impacts organizations like us. We do a lot of work with healthcare providers, so we have to sign BAs for each one of those organizations that we support. And it also impacts things like attorneys or any professional organization that might have access to PHI at some point. You basically have to implement the same protections that a healthcare provider would have to do. So that speaks to that third-party vendor conversation that we're going to have in a little bit. So keep that in mind. I'll put it, just keep that in the back of your head. But this year, or actually beginning last year, the government decided, hey, it's time to update the HIPAA rules. Technology has really exploded. The way we do business, the way we operate has changed so significantly that we need to tighten up these rules, because we're seeing a lot of healthcare providers and healthcare organizations or insurance companies. It seems like there's a breach pretty much every week that impacts patient information. So they said it's time to tighten the rules. So they rewrote the rules, and we'll talk about what that looks like in a minute. And then they finalized them earlier this year, and then they had a 60-day comment period. That is where the public could comment on the rules and make recommendations to what to implement, what not to implement. And then that was finalized on May 7th, so this month. And so now there's a period of time where those comments will be taken into account. Maybe they'll change some things, maybe they won't. Chances are they won't. The comment periods usually just gives people an opportunity to vent, but not really doesn't change anything. And the long and short of it is, once those rules are published, everybody that is either a covered entity, a CE, or business associate, BA, will have to follow the rules within about 240 days, and that's when it will take effect. So we expect to see it probably early part of next year when these rules take into effect. So let's talk a little bit about some of these rules. I'm just going to highlight some of the ones that I think are the most the most impactful. There's a requirement now for much more rigorous security risk assessments. So before, the HIPAA rules required that you did a risk assessment, but it didn't really specify when you had to do it, and it didn't specify what you had to do. Well, now they pretty much defined it down to the T, and they mandated that these risk assessments be done at least annually. There's more vigorous vendor oversight. And again, at third-party management thing, I'm not going to steal Anil's thunder, so I'll let him talk more about that. But yeah, they're going to require that these institutions do more to protect the information that maybe third parties have access to. There's more authentication controls. So, people in a lot of these organizations like to use shared credentials, for example, just to simplify things, or maybe not even use credentials. Like, one of the PCs may be on in an operatory with a generic login, and that makes it easier for people to log into it. But those sorts of things you can't do anymore. They're mandating now a tighter encryption of data at rest and in transit, which means that if data is stored in, on premise, on a server, or some sort of device, that data has to be encrypted. If it's stored in the cloud, then the cloud provider has to assure or provide evidence that they're encrypting that data in the cloud, so that if that data is somehow breached and taken, it can't be read. There's a requirement, and this is something that's going to really, I think, impact more people than anything. You're going to have a formal incident response plan in place for cyber breaches in particular. So that means that you're not going to, it can't be something that you just say, hey, when something happens, we'll figure it out. It's going to be, when there's an incident, here's the specific steps, here's all the people that are going to be involved, and you have to practice that incident response every year to make sure that it works. So you'll have to do a tabletop exercise, some sort. And we do that with a lot of our financial services clients, where annually you'll do a tabletop exercise to simulate an incident, and then walk through the steps of who would be notified, what would you be doing, when would you bring in the authorities, what third parties are involved. So, for example, if you're outsourcing your IT to a company like ours, we would be involved in that incident response. If you have a third party legal partner, like a law firm that you use because you don't have any attorneys internally, they would have to play a role in that incident response, and therefore they'd have to be involved in the tabletop. So that is something that is going to, require people to really think through how they manage that incident response plan and how they can test it. There's a tighter requirement for disaster recovery and backup, mandating that you are able to get back up and running within 72 hours of any sort of disaster. So that's going to, tighten up that particular requirement quite a bit. And then again, it will have to be tested. You have to demonstrate that it's actually being done. There's going to be a lot more requirements around network segmentation. That is, how you divide the network so that, potentially you can put all the parts of your network that have access to patient information in one segment of the network, and everything else in a different segment. So network segmentation is going to be another important important part of this new rule. And there's a bunch of other stuff that really digs into the minutia of basically managing risk and cybersecurity. If you want to learn more about it, reach out. We're happy to talk to you about it. But we will be communicating once the rules do get published. which we expect to happen sometime in the next 60 days or so, we will be reaching out to our clients and folks that we work with on a regular basis to let them know, hey, if you are a covered entity or a business associate, here are the things that you need to do to tighten your cyber compliance requirements to meet the new HIPAA rules. So with that, I will turn it over to Mr. Anil, who will talk a little bit about why this is important, why these rules matter, and how they impact third-party vendor management.
Yeah, thanks, Louis. Great information there. It's good to see that the HIPAA rules are finally getting updated. They've been stagnant for too long, as tends to be with these government policies. But good to see that that's coming forward. And like you said, a real big part of this is the third-party vendor management, which in a nutshell is basically saying that if there's a key vendor or a key partner that you work with that you wouldn't be able to do business if something happened to them, they should be doing their due diligence for their cybersecurity posture and hygiene. And this really started to become, more prevalent back in 2 years ago now, May of 2023, when, if some folks may remember, the MOVEit data breach that happened. And MOVEit was a piece of file transfer software that many different organizations used, from financial institutions to healthcare to government entities, you name it. And it was supposed to be a secure method of transferring files back and forth. And they got compromised. There was a 0-day SQL vulnerability, a SQL injection vulnerability to steal the files as they were being transmitted and decrypt them. And as a result, I think if I recall correctly, it was like over 90 million people's personal data was exposed, and all of these institutions were like, hey, MOVEit, why did you have your cybersecurity up to snuff? And it's like, well, no one was really keeping an eye on it. We were checking our boxes saying we were doing it, and apparently they weren't really doing it. So that was one of the first ones where people were like, the supply chain, as they like to call it, this third-party vendor that we're really reliant on, is MOVEit software, got compromised. And it wasn't our fault as the financial institution or the healthcare, but we should have been making sure that they were staying on top of their cybersecurity. And then again, the one that's going to really hit home right now, because we're talking about the HIPAA, and I think this was a big part of the HIPAA rules, getting their changes, was the one, at the beginning of last year, where, United Healthcare had a massive breach, the largest healthcare breach in history so far. 190 million Americans' personal data was breached. And it was somewhere in the region of they're asking like a $22 million ransom, and the estimates still think that the actual cyber attack cost United Healthcare somewhere between 1.3 and 1.6 billion dollars in lost patient fees and things like that. And the issue wasn't with United Healthcare, it was with their partner that did, patient billing and payments and insurance claims and all of that stuff. A huge company called Change Healthcare, multi-billion dollar corporation that just, they didn't have their posture up to snuff. The leak happened because some stolen credentials on the dark web got them through a Citrix portal into the network that had no multi-factor authentication on the user account. And this is a giant organization that just didn't have multi-factor authentication turned on. And the ransomware guys got in there and was able to move laterally through the network and steal the information they wanted. And once they felt they had enough, personal information, 190 million Americans, they just ransomed the entire thing. Just insane. So I think these are the this is the importance of third-party vendor management. Like for us, as an example, Alvarez Technology Group, we have, financial clients, and we have, healthcare clients that we work with. And so when those organizations undergo their, audits with the FDIC or whatever, we do as well. So we have to make sure that we're constantly keeping up, every year with our cybersecurity posture, and that we're doing the things that we say that we're doing, and that if we were to get audited, that we can show that we're doing everything needed to support that client. Cybersecurity insurance carriers are making this a requirement now, that you list out who your key third-party vendors and partners are, and that you're having them go through and prove that they are regularly updating their cybersecurity maturity and staying on top of protecting themselves as a company.
And we've, going back to the United Healthcare, that one, it impacted that organization. But one of the things that happened locally, if you remember, was that they stopped. Basically, this was one of the largest processors of healthcare claims, right? So Medicare, Medicaid, those sorts of things. And a lot of small providers depend on that cash flow that is generated when they file their claims, and then money shows up in their bank account pretty quickly. And that basically came to a halt. Mm-hmm. And so a lot of smaller nonprofits that provided things like mental health therapy, or that were doing small office work for plastic surgery, or things like that, they basically weren't getting paid. Mm-hmm. And this was a huge impact on them. They had to, we heard stories of local nonprofits having to lay off their entire staff because they couldn't pay them, and basically shut down and not be able to provide, mental health care that their patients needed, because they just weren't getting paid. So the ripple effects of something like this can be huge. And it's important that we take third-party vendor management seriously. Something that we're starting to have conversations with our clients about, in light of not just the new rules that cyber insurance carriers are requiring, but basically it makes good sense. And on the other end of things, many of our clients have received letters from their customers saying, hey, you need to attest that you're implementing basic cyber hygiene, and they list out the things that they're supposed to be doing. Unfortunately for them, they're covered by our managed security services, so those are all things that we are doing anyway. So we're able to get them to attest that they are following the rules and are in compliance. But a lot of folks out there are not, and it's important that if you are a large organization of any sort, and you have dependencies, you have suppliers and vendors that are critical to your success, that you make sure that they're not going to somehow suffer some sort of outage or some sort of breach that will compromise you and your ability to do business. If you're using a hosted provider, for example, to manage your financials, and then they have a breach and they have to essentially shut down for a week while they figure out what's going on and deny you access to your financial information, that's going to be a problem. So it's important that you take third-party vendor management seriously. If you want our help, happy to help out. Just give us a call and let us know that you need help, and we'll be happy to sit down and have that chat with you.
Yeah, that's a real key part of this, is that you have to identify who these vendors are first and foremost. I think that's really important, because I think some companies also, they haven't really been keeping an eye on who their most important partners are. So yeah, definitely give us a call. We can sit down, we can help you look at how you do your business and what vendors you rely on and cannot do business without. And we'll help make sure that they are doing what they're saying they're doing as far as cybersecurity.
Yeah, one of the things that insurance carriers are doing is, they're forcing us to do things to minimize the risk to them, right? Because at the end of the day, if there's a claim to be filed, they're the ones that are on the hook for it. So they want to make sure that as they learn more and more about what causes breaches and why claims are filed, they're going to tighten up. They're going to say, oh, okay, it seems like we're getting a lot of claims being filed because a third party did something that caused my the people with the policy to basically suffer some sort of financial distress that I now have to basically cover. So from now on, guys, third party management really important. Same thing with multi-factor authentication. You remember when that started to become a requirement a few years ago, and we had been talking to our clients about multi-factor authentication, till we were blue in the face, and they're like, nope, it's too complicated. My employees are not going to like it. Nobody wants to do it, so we're not going to do it. And then all of a sudden, their insurance carrier came to them and said, if you want a policy, you got to have MFA. They came back and said, all right, let's implement MFA, right? We need multi-factor authentication.
Yeah.
So in a way, I'm not a big fan of regulation for the sake of regulation, but I do like that, insurance carriers are forcing us to do the right things because it's good for business and good for us in general, even though we grumble about doing it.
Exactly. Yeah, no one ever said security was convenient, but it's important.
And and just like with the HIPAA rules, I think a lot of these folks that understand that people need to be forced to do certain things, organizations need to be forced to do the right thing in some cases, they're going to start tightening the rules. And we've seen it with the Department of Defense and their CMMC rules, and now we're seeing it with the folks that manage HIPAA saying it's time to tighten the rules and not give any sort of wiggle room. So there's no more addressable component to it. Everything's a requirement now. And as like I said earlier, as we learn more, we're going to be happy to pass on that information. So stay tuned. We'll continue to fill you in as the HIPAA rules start to roll out. We're happy to entertain any questions. If anybody's has any questions.
We've got a few minutes left here before we're at the top of the middle of the hour, and only so far was a nice shout out to one of our employees from Eddie Hathcock was thanking us for helping him when he fell for the sheriff's phishing email. So some great news there, and I'll definitely pass that feedback on to Sean. But if we don't have any other questions, then we can give everyone a few minutes back to their day.
Yeah, well, thank you all for joining us. Come back next month. Don't know what our topic is going to be just yet, but we'll be on the last Thursday of the month at 10 a.m. So join us in June when we'll talk more cybersecurity. Otherwise, take care and enjoy your weekend.
Take care. Thanks, everyone.